And so you've got growth plate up in this region, especially right up in here and right down in here for the bottom. It's not quite as large on the bottom though. And so all the new cells are produced here, and they slowly migrate in this direction down to the very tip where they're worn off. And this is the same thing for us. This is the same thing for your dog's toenails, very, very similar stuff. And so we had the damage to the beak was actually in this region right here on one side. This is just one, your beak is this wide, this is just a slice right here. So everything might have been normal except for this section, and that's what the problem is. This is a normal looking eagle beak. This is what it should look like. And this is just another close-up x-ray here of the bone and the actual hard keratin that's on the outside of the beak. This sort of section is bone. Let's go back to that so you can actually see the white point down to here. So that's bone. And then that, all the way down to the bottom, is this hard beak area that grows over top of the bone itself. So, we decided to cope this bird. And coping is a falconry term that just means to shave down some of the hard keratin structure on the beak and on the nails. And first of all, you just need to get organized. You need to cast the bird, which basically means get control of the bird so that it's not going to be doing damage to itself. You need to minimize stress, so by using a hood whenever possible so they can't see what's going on, and that will actually calm them down. You can use sort of inside voices on this one because you don't want to stress them, and then anesthetize if necessary. And if you're going to be doing a really traumatic job, you may be going up into the area where you could be hitting nerves. You always want to actually put these birds under with the general anesthesia. Work quickly but carefully, and then if the bird gets stressed, stop, take a break. You don't have to do everything all at once. This is something that you can do over several days if you're going to do a lot of damage to the bird initially. And this is obviously not an eagle, but this is just an example of what we actually do when we cope a beak. We take a Dremel with a sort of pointed beak on it, or a pointed drill bit, and we shave on one side, we shave on the other side to make a really sharp point, and then we go from the bottom and move up so that you actually reduce the overall length. So, just sort of a walkthrough series from different months of 887 here. This was, well, back in July, 2 weeks after the actual surgery, which I believe occurred on the 13th of July. And so this was him without his contraption on. And this was in September. So the interesting things to me here are that you can see that we definitely still have this, this crossing over. We've actually dremeled away, and this was during the surgery, a large section of the side of the lower beak, because what we didn't want to have happen is that bottom beak, the top beak to rest on the bottom beak and sort of push it further and further and further over. So if you take away that resistance on the bottom, it may give the upper beak a better chance to grow straight instead of being forced over mechanically. You can see that the hole on top is completely healed in by this point. This is only 2 months after the surgery itself. And so it really speaks to birds' ability in general to heal. They heal much faster than mammals do. And so it's completely healed in. This pink tissue is actually, it's called granulation tissue. So when you get a scab on your hand, you first have that, the scab that sort of pops off, and that pink material that's underneath. It doesn't quite look like skin, but it's still fairly tender. That's what this is. And then we see this sort of white tissue down here where the beak is starting to grow back from the surgery.
So this is 2008.
Yeah. 2008, thank you. Yeah. And looking straight at him here, and you can see that his eyes are closed. You can see it's very shiny around his eyes, and that's a lubrication that we put in his eyes when they're actually sleeping, so that their eyes don't get dried out and they don't get corneas, or ulcers, sorry, on their cornea. Front view, we had the same thing on the bottom. We shaved away a lot of the bottom left beak. We also shaved away a lot of the upper right beak, again, to prevent that kind of twisting from occurring and give the top beak an opportunity to grow straight if it can. October, another month. That pink tissue is pretty much gone. Now we're getting into some sort of scaly, flaky tissue of the new keratin that's going to be formed. Keratin is essentially the same material as your fingernails. And I put this picture in here because I wanted to point out this little brown spot here, and this little brown spot here. I did that. I physically went in with a little heat gun, and a little human heat cauterizer, and I just made a little mark on the beak. Little dot, 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 and I did it all the way over to the other side, and I wanted to see if, with time, they all grew at the same rate. And they didn't. Essentially, this one stayed the same. When this one was here, this one was here, but the one on the other side would have been about here. So this side is growing faster than the other side. The next month in November, everything's looking good, healing up nicely. It's getting black and shiny now, so this is really starting to harden up. December, it actually looks a little bit scrapier here. How about you can see the twist is getting even more pronounced. And the same thing here, it's getting, the point of the beak is going further and further over. February, it's looking thicker, but it's still twisted. Great hairdo. And you can see this, we also have to consistently, every couple of months, take away the length of the bottom beak, because it continues to grow normally. And in a wild bird, what would happen is it's prevented from growing too long by the upper beak, which goes right over top of it. Yeah. Well, that upper beak doesn't go right over top of it, so it just continues to grow out further and further and further. We see that in a lot of rodent species as well. In rabbits, what will happen is they damage their top teeth, then the bottom teeth don't have anything to wear against, so the bottom teeth keep on growing. So you do see a little bit of blood here. And that's the normal procedure every couple of months for him when we have to do this, because we have to really trim back as far as we can. And it does work the same way as dog nails. So if you do trim more regularly, the quick will go back further and further. But we're back so far right now, we have a very, very thin quick layer, and then we're into bone. And you don't want to go back as far as bone unless you're in a surgical setting, because you don't want to run the risk of bacteria basically getting into it and causing a systemic infection. And we've got a big step here. I just didn't have the pictures on my computer, but we're into August, which was the last set of pictures that were taken. You can see how stunted the top beak is. It should be out to about here. And the other interesting thing is if you look at this bottom beak, and if you sort of take a measurement from the point of the nostril right here on this side out to the point of the beak, it's 4.3 centimeters. If you do the same thing on the other side, it's 3.1, much, much shorter. And so essentially what that tells me is this side is growing faster, and it can't go straight, so it just continues to grow over in this direction because this side isn't growing as quickly. Yeah.
So it's going to continue growing.
And it will continue doing that unless we continue growing. Yeah.
Does it continue to grow? I mean, does it ever stop growing?
No, it grows for its entire life. Yeah, wow. Because if you ever have any kind of damage to the end of the beak, you want to make sure that it can grow back again to hit a chip or something at the very tip. So it's very much like fingernails. So you can keep on trimming it at the very end. They continue growing for their entire lives. So that's the unfortunate circumstance there. So we sort of get into the future, which Ed kind of talked about a little bit here. And so we do have permanent damage to the growth plate, so that's never going to go away. One of the things, we're almost up to beating our record this year for a number of eagles admitted over the course of the year. We had 36 a couple of years ago. I think we're at about 33 now, 34, 33. Yeah. So, and we still have a couple of major eagle months left in the year. We usually get quite a few in November, December. So we're getting to that point. So a lot of these birds, we try to get them back out into the wild. That's what our goal is. However, not all of them can make it. Sometimes they have permanent damages to their eyes or to some of the wrists or other bone structures that just won't allow them to go out there. So we try to place these birds whenever possible into other education facilities. And for the last last year anyway, we've had more and more difficulty trying to place eagles because the population in general has been rising, and there's more eagles that are damaged out there, and they tend to go to the facilities. So there's just not as many homes.
When you dremel, you said you dremel on the sides. Is it feasible to go in the front so that maybe that side that keeps longer will...
Well, the problem is that since it grows from the very back out, in order to prevent that from happening, you essentially need to actually damage the other growth plate in order to slow it down. So just because you're sort of attacking at the very end, it's still going to be growing faster when it grows in again. So, and I'm not in the business of going and doing harm to perfectly normal growth plates to try to do that, and because there's no guarantee that it would work. So we are basically having a harder and harder time of placing eagles that are perfectly stable. You know, they may have an eye injury, so they're blind in one eye, they can't be released into the wild, but they're perfectly fine in captivity. We're having a hard time finding those guys.